Being healthy is a realistic goal for persons with disabilities, and healthcare professionals can play a major role in helping them achieve that goal. It is important to ensure that your clinic is welcoming and accessible to all patients.
My name is Mike Honig, and I'm blind. I've been blind since birth from Leber's congenital amaurosis, and I've learned to make my blindness just one small part of who I am. I've figured out the best ways for me to learn, work, communicate, enjoy life, and just be myself. I'm an active community member who enjoys many hobbies and interests. Some of those hobbies and interests are travel, gardening, traditional jazz, sports, and cooking. I've also learned what works and what doesn't work for me in healthcare settings. The objectives of this training are for you to recognize what a disability is, recognize the prevalence of disabilities and health disparities, learn strategies for communicating with people with disabilities, including active listening and teach back, and communicate more effectively with all patients.
In this video, I will introduce you to several persons with disabilities and a family member who will share best practices for communicating with and accommodating patients with disabilities. These best practices are based on real-life situations which individuals with disabilities and their families have experienced while interacting with healthcare professionals.
Hi, I'm Angie Plager. I'm a quadriplegic due to a spinal cord injury as a result of a car accident at the age of 20. I love volunteering and being an advocate. I'm currently the president for the Spinal Cord Injury Association of Iowa. I also love spending time with my family and friends. I like to do some events that give me a little bit of an adrenaline rush, like deer hunting, paragliding, water skiing, just to name a few. No matter what I'm doing or where I am, having high quality healthcare is very important to me. It helps me continue my desired lifestyle of, being very active and helping others and being out and about in the world.
Hi, my name is Sally Green. I had an asphyxiation at birth, and I was diagnosed with cerebral palsy at around age 3. I've also had dysphagia since birth, and I eat with a feeding tube. I have a sensory neural hearing loss and vision challenges from the lack of oxygen. When I was 13, I was diagnosed with obsessive compulsive disorders, nonverbal learning disorder, and anxiety. I've had a lot of interaction with the healthcare system, and as you can imagine, my disability has played a big part in that. I'm an Eagle Scout. I like to ski, and I'm very active in my community. And I just recently graduated from the University of Northern Iowa.
Hello, my name is Sylvia Townsend. I grew up in Iowa, and I'm a student at the University of Iowa. I love hanging out with my friends, cooking for my fiance, and skateboarding. I was born able to hear. At the age of 3, I experienced an illness that left me profoundly deaf. I have worn hearing aids ever since, but need to read lips and use sign language to make sure I understand everything that's said to me.
I'm Mary Roberts. I am the parent of 2 young adult children, both of whom are profoundly affected by autism.
Best practice number 1. Recognize that as a healthcare professional, you will treat a significant number of patients with disabilities.
According to the ADA, the Americans with Disabilities Act of 1990, a disability is any long-term mental or physical impairment that substantially limits one or more major life activities, such as a person's ability to walk, speak clearly, breathe, see, hear, or learn. A disability can have a mild to a profound effect on someone's life. Many people don't realize that more than 50 million Americans have some type of disability. That's about 1 out of every 5. As you might expect, disabilities increase as people get older. Less than 10% of children under 15 years old have a serious disability, but nearly 75% of people over 80 have a disability. As you can see, disabilities affect people in different ways and can occur at any time in life.
Best practice number 2. Communicate directly with patients with disabilities and ask them to guide you in methods for providing accommodations. In this first demonstration, Angie will show how important it is to greet patients with disabilities by speaking to them directly.
Hi, I'm Ann. I'm Dr. Johnson's nurse today, and you are?
I'm Peter Wilson. I'm Angie's personal assistant.
Well, great. Peter, could you tell me why Angie came in for a visit today?
Angie just asked me to drive. Angie would know more about the reason for her visit.
Oh, hi, Angie. Could you tell me what we can do to help you today?
Sure, I'd be happy to, but can we first move so that you can sit eye level with me so I'm not straining my neck to try to talk to you? If people do not look at me or speak to me directly, it makes me feel invisible. And it's frustrating to think that they feel I cannot speak for myself. Just because my body doesn't function the way that theirs does not mean my mind is not functioning.
And before we begin, since you brought Peter, your personal assistant, with you, I need to know, do you want him to stay in the room during your health history and exam, or do you want him to wait in the waiting room?
I think he can wait in the waiting room during the health history, and then he can also be a help to transfer me to the exam table.
In this next scene, Angie demonstrates how to effectively accommodate your patient's physical transfer needs.
Now that we've completed your health history, what I will do is put a notice out for the doctor, and he'll be in just a few minutes.
Okay. Would it be all right if I transferred to the exam table before the doctor got here?
Sure. And how would you like to be transferred? I can get a lift, or...
My personal assistant can help, and we'll do a 2-person transfer.
Okay, could you instruct me and Peter how you want to be lifted?
Sure. Pull up close here. I'll have you grab support underneath my upper legs, and Peter will come around behind me and around my back and grab my arms, and then I'll count to 3 and we'll lift up and over onto the table.
Okay, this is an accessible table, so I can lower it a little bit. Would that make your transfer easier?
Yeah, if it's the same level as my seat, that would make the transfer much easier.
Okay, I'll do that.
It is always important to ask somebody how they want to be transferred. Some prefer a lift, some slide board, and some like to use their personal assistants. And when asking how someone wants to be transferred, be sure and listen to their instructions. People like to be transferred in different ways. Not using an exam table makes many people with disabilities feel like they're receiving substandard care. I know someone who did not get a full health exam or full skin integrity checked for 5 years because the doctor didn't think it was worth transferring her to an exam table.
In this scene, Angie will explain why it is important to ask permission before moving a patient's adaptive equipment.
I need to move your wheelchair before the doctor comes in. I'm just going to put it in the hall.
Oh, actually I'd rather you not just put it in the hallway. My personal items like my bag and my wallet are attached.
Oh.
If you do need to move the chair, can we leave the bag here, and then if you would take my chair to my personal assistant in the waiting room? I feel really insecure when someone moves my chair without my permission. If it gets damaged, I'm in a real predicament. Medicaid only covers the cost of a new chair every 5 years, so a repair can be very costly and may take a very long time. It is important to note that people's assistive devices and technology is an extension of themselves, and they get very comfortable and used to a certain brand and specific type of equipment.
In this scene, I will demonstrate the importance of asking patients who are blind how they prefer to be guided.
Mr. Honig?
Yep, that's me.
Oh. I'll show you to where your exam room is.
Okay, just a second. Who are you?
Oh, I'm Ann. I'm sorry. I'm Dr. Johnson's nurse. I'll show you where the room is.
Oh, okay.
Great. If
All
you'll
right,
come
actually,
this
you know
way.
what? If we could just do this a little differently, if I could just
Oh.
take your elbow here and then walk right behind you about a half step. This is called sighted guidance. It's a good little technique.
Great. It is easier for everybody. Do you need additional information, right or left?
Just when we get into the exam room, just to know where the table is, would be helpful.
Okay, we're going through a doorway really quick. And the exam room is on our right.
Okay.
And actually, when we walk through the door, the table is on our right.
Oh, all right. Sounds great.
Best practice number 3. Develop strategies to help patients complete forms and receive information in accessible formats. Inform all clinic or unit staff about using these strategies.
Providing the opportunity to complete intake information in advance, either by phone or electronically, is best practice for everyone, not just persons with disabilities. It saves time for the patient, the health provider, and support staff on the day of the appointment, while ensuring patient privacy. In addition, I recommend that you develop a standard protocol for gathering intake information in a confidential manner on the day of the visit for those patients who prefer to provide it in person.
Best practice number 4. Use TeachBack to ensure that patients understand directions and determine how they will incorporate new treatments into their daily routines.
Hi, Mike. I brought in your discharge orders.
All right.
With a summary of the medications and changes that you and your doctor discussed.
Okay.
So I have them right here, and I'll hand them to you, and you can have your case manager or your support worker read them to you when you get home.
Well, you know, actually, I don't have a case manager support staff, so I'm going to need to work with you to be able to access this information.
Okay, well, actually, do you have anything that you can write the information down on?
I have this little device here called the Braille Note. It functions like a Braille laptop, and this is a little display right here, and as I type, the Braille will just appear as I tap on these 6 keys. So I already anticipated that there would be something I'd need to write down, so I've got a file open here, and I'm ready to write.
Okay, well, I will read the doctor's orders to you, and after I'm done, I typically ask people to read it back to me.
Okay. Okay, got it.
Could you repeat those back for me?
Sure. You want me to take 10 milligrams of omeprazole daily for my acid reflux and 10 milligrams daily of lisinopril for my high blood pressure.
Perfect. There's only one other thing that the doctor wants to do is he wants you to monitor your blood pressure every day. Typically, we would prescribe a blood pressure cuff and have people take it at home and then report to us.
Okay.
However, I don't know if there's a device out there that's accessible for somebody that's blind. So could you tell me how you would build that monitoring into your daily schedule?
Yeah, actually, I think for the short term, I happen to work in a facility where I would have direct access to healthcare providers. And then for the long term, there are companies out there actually that make talking blood pressure cuffs. So I'll start doing some research.
Great. Well, it sounds like you have a plan in place.
Best practice number 5. Develop communication strategies to meet the needs of patients with hearing impairments, speech disorders, and intellectual disabilities. In this demonstration, Sylvia will describe how to develop a communication plan with patients who are deaf or hard of hearing. The voice you will hear is that of her interpreter.
Healthcare providers should always develop a communication plan with patients who are deaf or hard of hearing in advance. I can tell you from personal experience that this process will not only assist with communication but also make the patient feel more relaxed and provide reliable test results. Persons who are deaf or hard of hearing communicate in many different ways. You will make communication go much more smoothly if you ask which method the patient prefers: sign language interpreter, lip reading, or writing on your admission form. If your technology allows, use the information on the intake form to pre-arrange accommodations. A general rule for interpreters is to arrive 15 minutes before the assignment. In addition to providing communication assistance, the presence of an interpreter can be reassuring to patients and help reduce anxiety if they do not understand office routines. American Sign Language and Signed English have two entirely different structures. Therefore, it is important to make sure that your deaf patients understand written instructions. Be aware that some deaf individuals may ask the sign language interpreter for assistance with written material, which is another very good reason to comply with requests that an interpreter be present. Never ask family members to ask as interpreters, especially children, but do honor the patient's request if they wish to select a family member. Video remote interpreting, or VRI, is a good option for emergency situations. VRI is a service which uses devices such as web cameras or video phones to provide sign language interpreting. If an interpreter is delayed or if there's an emergency situation, it may help for you to know some basic signs to help direct your patients during an exam. Stand up, sit down, lie down, breathe in, hold your breath, wait, roll to the left or to the right, finished, thank you. I suggest that you post pictures of these signs on the wall in the exam rooms for reference.
In the next demonstration, Tyler will show how to work with a patient whose speech is difficult to understand.
Hi, I'm Ann. I'm Dr. Miller's nurse today.
Oh, hi, it's good to meet you.
And I'm wondering, did you bring your guardian with you today, Tyler?
I actually don't have a guardian.
Oh, well, that's good to know.
Yep.
Then we can go ahead and begin. The very first thing we need to do is to have you fill out this health history form. So I'm going to leave it with you, and I'll be right back.
Actually, I have a hard time writing, so would you mind helping me out with that?
Oh, not a problem. We'll fill it out together. So the very first question we have is, will you tell me about your physical conditions?
Sure. I was born with
Cerebral palsy?
Yeah, actually, I know that you guys are in a hurry here, but, I would kind of appreciate it if you can finish my sentences. Sometimes it just takes a little bit longer for me to say some things.
We know you have cerebral palsy. Can you tell me if there's additional physical conditions or concerns?
Over the past 2 months, I've been feeling kind of depressed, and I wanted to know, is that normal?
Mm-hmm.
Did you understand that?
Well, actually, I didn't quite understand what was happening over the last 2 months.
Yeah, I've been feeling kind of depressed over the past 2 months.
Okay, so feeling depressed for 2 months, you're wondering if that was normal?
Yeah.
Okay, actually, the doctor will really want to know that and talk with you about that, so I'll make a note.
Okay.
All right. And can you tell me now what you do to keep yourself healthy?
I do karate.
What was that?
Karate.
Boy, I seem to be struggling. Can you tell me again?
Yeah.
Oh,
Karate. Yeah.
that does keep you active.
Yeah, it does.
All right. And do you have any other questions or concerns that you would want to talk to the doctor about?
Yeah. My girlfriend and I are getting very intimate, and I was wondering if what the options were for contraception or things like that.
Okay, I understood something about you and your girlfriend, but can you think of another way to tell me what your question is?
Safe sex.
Oh, you'd like to understand about methods you can use for safe sex. Mm-hmm. Great. I will write that down as another thing the doctor can talk with you about. And I believe that we're finished with the health history.
And there's a lot of good communication techniques. She asked me to use different words. She asked me to repeat things. And she asked me to demonstrate what I was trying to say through actions. You can also do things such as ask yes or no questions, or use a fill in the blank to effectively communicate. A speech impairment does not mean that someone has a cognitive impairment. Understanding comes with contact.
Visual cues can be very helpful in working with a patient with autism. They're very visual thinkers and visual learners, and so they'll have an accurate idea of what to expect before it happens. So for example, if you are going to be doing x-rays, there can be pictures, and they can either be actual pictures or they can be drawings. They can be, there's a program called Boardmaker. They're kind of pre-drawn pictures that can plot out the procedure, and it can be depending on the patient's ability to understand, and this is something that you should discuss ahead of time with the care provider. It can be 2 steps that, open your mouth and put in. It can be 10 steps that really kind of plots out very specifically what they can expect and what the procedure is going to involve. And a lot of times being able to see it ahead of time, and then as you're going through the procedure itself to kind of reiterate, this is the step we're on and this is what's going to happen next, really helps them feel part of and aware of what's happening to them.
Best practice number 6. Reduce anxiety for patients on the autism spectrum.
A lot of people with autism have they have a lot of difficulty with sensory dysfunction. And so things that we as neurotypical people might not be aware of could be extremely anxiety provoking to them. So to be made aware of those ahead of time could be very helpful because you could take steps to help minimize that. Sound is a big one. So minimizing sound, especially unnecessary background noise, like a TV in a waiting room, if that can be muted. Radios playing in the background of the office space can be extremely agitating. There's going to be some sounds that cannot be changed, such as drills or things like that. A lot of parents will bring headphones with to kind of cut down some of the background noise or the sounds. It might be something that you can have extra noise-canceling headphones available in your office. Touch is another tactile. Autistic people tend to be very tactily defensive. So one of the things that I do with my son, for example, light touch is like extremely agitating to him. but we kind of use very firm touch when we need to touch him to move him or reposition him or something like that.
Best practice number 7. Accommodate your patients with invisible disabilities. Other disabilities that may not be easily visible include mental illness, intellectual disability, and autism. Some patients who experience learning disabilities, a traumatic brain injury, mental illness, intellectual disability, or autism may find it difficult to understand, read, or process the information contained in standard treatment plans. Many of these patients may not be comfortable disclosing that they need help in explaining their health problems or understanding instructions. However, you can learn a great deal about the preferred learning style of each patient through close observation and direct questioning. Remember, too, to avoid wearing perfumes or colognes or using cleaning products that may contribute to headaches or breathing problems in sensitive patients. Best practice number 8. Treat people with disabilities with the same respect you would give any other patient. Do not make assumptions.
Those of us with disabilities want you to know that our disability is simply a fact of life. It is neither a focal point nor a point to be ignored. A disability is part of who we are. When working with persons with disabilities, it is important to treat them with respect. Treat adults as adults, even when they have intellectual disabilities. Assume I can do things with or without supports instead of believing I can't do something. Make decisions with me, not for me. Help me see my opportunities instead of limiting my choices.
We hope you have found this video helpful and applicable to your work as a healthcare professional. For further information and resources on treating patients with disabilities, visit www.livingwelliowa.org and search under the Health Providers tab.